one of the things I want to talk about here in the remaining 2 clips of the show that we're going to cover, and again, I'm sorry, we're not going to do phone calls today, so if Big Hook wanted to call in, I'm sorry. But anyway, we have RFK Jr. in Texas at Texas A&M with Secretary Rollins, talking about a whole bunch of stuff. Again, I didn't watch the entire video, but I think this part of the video is where he says the thing I want to cover. But if it's not, I'll get to the point. I'll get to his words as well. So let's listen for a smidge just to see what he's saying.
Working very closely with the governor of Texas, with the public health officials in Texas. We've provided them enormous support from CDC, all the support that they've requested for vaccines and for alternative medicines. Or budesonide, these are not fringe medications. These are medications that sick people should get. Are proven medications, clarithromycin, aerosolized steroids, so that we're not just talking. There's certain people, and particularly in this state, who don't want to vaccinate. We have to take care of those people too. CDC has been.
There are people who don't vaccinate. We have to take care of those people too. Why? They are effing around and they're finding out. Should we take care of the kids? Yes. The kids who parents, they don't want to vaccinate them. We should absolutely help to take care of those kids. Absolutely 100%. We should take care of those kids. And, and it should be viewed as child abuse if you're not giving your child the measles vaccine unless the doctor specifically has said that you need to not have a vaccine for a very specific reason, right? For a very specific reason. If we say that, then sure, I can trust that, whatever. But everyone else, it should be considered child abuse to not give your child the measles vaccine. Should be considered child abuse. And and if you're an adult and you choose to not be vaccinated about the stuff, F around, find out. Let's continue.
Been focused for many, many years, for a generation now, just on one solution, which is vaccines. We need to be able to treat people.
We've been focusing on many things, including vaccines. I wonder why that is. I wonder why we've been focusing on vaccines. That's because the measles vaccine works. You stupid ass. The measles vaccine works. And we've managed to eliminate measles in this country because we have a measles vaccine. Guess what? If you get rid of the vaccines and you put lack of faith in the vaccines, or you try and convince people that there are other things you can do, people are going to start not believing that the vaccines that work, and they're going to stop taking them and stop giving them to their kids. And then people are going to, that's why we're seeing what's going on in Texas, because you've seen these people just not want to take vaccines because they've allowed the anti-science people to put doubt in the minds of vaccines. So if you allow that to happen, you see things like that. One of my concerns during COVID and the people being vaccine deniers was the fact that not the COVID issue. I mean, that was an issue, but it was what happens the next time if we have the next time happen. If the next time happens and we have an even more dangerous virus that comes out, these people are not going to take it because they've been made to distrust vaccines. Right? That's the problem. And that's what we're seeing here in Texas with this measles outbreak.
Who gets sick. And that's one of the things that we're going to focus on as well. We're doing very well in managing the measles outbreak.
No, you're not. There shouldn't be a measles outbreak. Doing very well in handling measles outbreaks is making sure that you don't have one.
The measles, although the numbers are still growing.
We're doing a very good job of containing it, but the numbers are still growing. What? I think the worm has done much more damage than people think.
The rate of growth has plateaued. You compare us,
The rate of growth has plateaued, even though it's growing. Oh, so we're careening into a brick wall in our car, but we're not accelerating anymore, so things are good, right? That's what that means. That's the same kind of logic. We're doing a good job managing the driving of this car, even though it's careening right into a big concrete pole. But we're okay. We're good because we're not accelerating anymore. Freaking morons.
We've got now, I think of this morning, about 842 measles cases in this country. Canada, which has 1/8 of our population, has roughly the same number. Europe has 10 times that number.
So we should strive to go downward. We should strive to not be the best and be okay with mediocrity with other countries that are doing, worse than us as an excuse.
Last year, Europe had 127,000 measles cases and 37 deaths. We've had in our country.
And we're not Europe. We're America. We're Americans, not Americans. We should be able to be the best country in the world when it comes to this. We're not now because we elected Donald Trump as president with low information voters or whatever, and we got you as the head of the Department of Health, which is one of the other dumbest things we could have done, period.
Country, 4 deaths in 20 years. We have an autism epidemic in this country where 100,000 kids a year are diagnosed with autism. We've gone from 1 in 10,000 to 1 in every 31 kids.
We've discussed this on the show before. I'm not going to rehash why he's stupid about this, but he's stupid about this.
We have a diabetes epidemic. When I was a kid, a typical pediatrician would see 1 case of juvenile diabetes in his lifetime, over a 40 or 50-year career. Today, 38% of the kids who walk through his office door are diabetic or pre-diabetic. Those should be the concerns that the press should be covering. Every child who gets measles gets a headline. When I was a kid, there were 2 million measles cases a year, and nobody wrote about them.
Because when you were a kid, measles was a problem. And now we have a vaccine that works that prevents people from getting measles. But now, because of the anti-science, anti-vaccine dickwads like yourself, measles is growing again. And guess what? That's why it's a news story. That's why it's a news story, because we shouldn't be having this. And it's happening because low information, stupid people have been conned and duped into believing that vaccines are dangerous, that vaccines cause autism, that vaccines do a whole bunch of other stuff that they don't do. The one thing that vaccines do correctly and accurately and well is stop measles. So when we now have measles coming into America and growing at the same rate, I guess now, but at a higher rate earlier, but still growing, that is newsworthy. That's why you see a news article about it, you dumbass. And the reason we don't see the news articles about people with autism is, again, as we talked about previously on another show, the reason we have more cases of diagnosed autism is because we have better methods of diagnosing autism. We understand autism better. We know what it is. We know how to see it, and we know how to see for cases that weren't seen earlier. And just as Krista said in the chat, just because you didn't see it doesn't mean it wasn't there. But now we see it. And there is a time when George Washington was president, nobody knew that dinosaurs existed. There are like biblical stories about monsters or whatever, but nobody knew that dinosaurs existed. And then sometime in the 1800s, guess what? They found bones of dinosaurs. They found the fossils. So guess what? Now we know that dinosaurs existed. Because we were able to find the dinosaur bones, because we were able to do that, guess what? That doesn't mean that dinosaurs never existed up until that point. It just means we now have better tools, better abilities to see what's in the ground and then find those dinosaurs. He's like, oh, I can't see it. It doesn't exist. That's the mindset of a 2-year-old, not of an educated, well-meaning, well-thinking person. Somebody who hasn't been, had their brain rotting from a brain worm.
Why aren't people writing about the autism cases? 100,000 kids who shouldn't.
They do. There are plenty of people who are looking into autism. But it's not newsworthy because, again, many of the cases, most of the cases that are the new cases that have been found because of our new diagnostic capabilities are the mild cases. And it would be a problem if we had these cases of autism and we were not dealing with them. Like we were not allowing people to have an IEP or a 504 plan so they could have a individualized education plan to be able to, have an educational environment that's going to go to them and understand what their specific needs might be on the case of the individual, which is why it's called an individual educational plan. But y'all going to get rid of the Department of Education in the Trump administration, and then nobody's going to enforce that. But yes, when we completely wiped out a virus from this country by having a good, robust vaccination program when it comes to measles, and then it starts coming back, that's absolutely fucking newsworthy. That's why. Anyway, are you somebody who believes in RFK's whole BS about vaccines and measles and when I was a kid, whatever? Leave your comments down below. If you agree with me, leave your comments down below. Remember to like the video, share, subscribe to the channel, unless you're a Nazi or support Robert FK Jr. on his malarkey. Have a good day.